first things first, we're gonna have our required uniform for our test. We already know what that is. Scrubs, clinical coat, nails free of artifacts. In this case, it really just means no nail polish, length, all of that good stuff. We're gonna make sure that we have our eyewear near, masks, gloves, and then our cleaner. I'm gonna show you in the event that we don't have a stick, how we can do it. Remember, you're not gonna need to use this every single time, but if you notice that there's something underneath your nails or you just wanna give an extra little cleaning, I'm gonna show you how to do that, okay? All right, so prepare to wash. We're gonna make sure that we have all of our jewelry off, watch, rings, and we're gonna roll up our sleeves. Next, we're gonna wet our hands. We're gonna wet the hands and apply soap and just start that circular motion, removing that gross debris. Remember, gross debris is just any kind of visible or anything. It's just gonna kind of help to make sure we don't have anything yucky on our hands. Next, in the event that we have debris under our nails, we're gonna use either a stick or a brush. So a nail brush is exactly that, like you've seen before. This is the stick, okay, and it has just like a little flat side. We would go under our nails and just clean out any debris that might be there, okay? So you'll be able to demonstrate it. Let us know that that's how you would do. Put your stick off to the side. Our other option, if you didn't have anything but yet you knew you wanted to make sure, you can cup your hands just like this. And with that soap, I'm just kind of like moving my fingers around. It's just forcing that soap and kind of the friction up underneath your nails, okay? All right, so we've done that. Now we're gonna take more soap, start lathering again in that circular motion. And this is when we're gonna do that sequence. So we're gonna start with our palms. This is that peanut butter, then fried wings. It's gonna take around 15 seconds. Palms, remember backs of hands. We're really opening them up. Jazz hands there, right? Backs of hands, thumbs. So then, fingers, fried, and lastly, wings, wrists, okay? So 15 seconds. We're then gonna rinse our hands with that lukewarm to cool water, and we're gonna keep our hands facing down. And can you see that when I do it? I'm not going up and down like this, because now whatever bacteria or whatever we freed up, we don't want it going back and forth. We want it going right down, right into the sink. So it should be around 10 seconds. You can do both hands, however, whatever works for you. You can do one hand at a time. You just want to make sure you're getting all of that soap completely off of there, okay? Around 10 seconds. We're then gonna dry our hands. Can you notice I'm just letting them kind of chill out? I'm not gonna take them and shake them and get it everywhere. So I'm gonna grab a towel and I'm gonna start at my fingertips. And you're gonna use as many towels as it takes, and you go down, okay? And the trash, sorry. My hands are still pretty wet, okay? So I'm gonna go, and I never go back up. If I now go back up, same thing. I'm pulling anything that I might have missed, back up, okay? And other hand. Trust me, you want your hands to be dry, okay? Hands are dry. I'm gonna take that last towel, pull my sleeve. If you forget, just grab another towel, okay? Take my towel, pull my sleeve, throw it away. It says, good, dispose of paper towel, did not contaminate hands at this point. That means I haven't touched anything, okay? I've only touched the water, the soap, and the paper towel.
So that means while she's washing her hands, if she touched the sink or the bottom of the sink or anything, she would have picked up more bacteria.
Yeah. Now, these sinks, when you practice, you'll see, the sinks don't always want to turn on, and you start to want to like hit it, don't, okay? Even when you grab the paper towel, if you hit something else, it's contaminated, and you would just need to rewash your hands, okay? So that's not contaminating. So our hands are clean at this point. We could set up a treatment area. So we'll talk more about in later labs that we can do a lot in dentistry with clean, dry hands. Not everything has to have gloves on our hands. Clean, dry hands, we can now go into that operatory that's disinfected and set it up, okay? So that's what we could kind of go ahead and do now.